Good afternoon, everybody. Thank you for attending the Enroll Nebraska Heritage Health and Enrollment Assistance webinar today. We are happy to have a lot of folks registered for the webinar, and we're excited to have a great speaker on the phone to share a little bit more about Heritage Health and the enrollment process with the enrollment broker system in Nebraska. We are going to use this time wisely, but I think we have a lot of opportunity for asking questions. We're going to hold those questions for the end of the broadcast and do the question and answer at the end, just so that we have the chance for our speaker to answer any questions that come up. So feel free to type those questions in the chat box. That's the way we're going to be doing questions in the bottom right-hand corner. Before we jump into our presenter and what our main topic is for the presentation, we're going to just go over a couple things. My name is Eric Saviano, and I am Enroll Nebraska's statewide coordinator. We are a coalition led by Nebraska Appleseed, and this is my contact information. It's going to show up a little later as well. So be on the lookout for that. And if you have questions at any point, need to be hooked up with slides or any materials, or have questions related to this presentation, now you have my information. I'll direct everybody also to enrollnebraska.org/EEG to find the materials related to this presentation, a couple of flyers to download, and if you need to, download the slides themselves, which are also on the website for download. We'll be referring to each of these things throughout the presentation. All right, once again, the chat box is open down at the bottom right-hand corner for questions, and we'll do our best to get back to you about those. We're going to talk a little bit about Enroll Nebraska. Then we're going to hand it over to our speaker, Linda Becker, to talk a little bit about Heritage Health and the new Medicaid managed care system in Nebraska. And then we're going to go into some questions and answers related to that. So like I said, we're going to do a quick overview of Enroll Nebraska and some of the services that we offer as a coalition. We are the statewide network that is working to bring people together around the Affordable Care Act. We are trying to engage folks in getting health insurance through Medicaid, but also through the health insurance marketplace at healthcare.gov here in Nebraska. And we do that by engaging with enrollment assisters like navigators and certified application counselors in the state, but also with community organizations, healthcare providers, and advocacy groups. We have resources we offer to everybody in the state at enrollnebraska.org. that include a locator system to find enrollment assisters closest to you. It's been proven that folks help get insured a lot better and a lot easier through an enrollment assister, so we encourage people to find and use those folks around the state. Events calendar and resources. To stay up to date on these webinars and future webinars, future opportunities and media related to Affordable Care Act and healthcare in Nebraska. The best way to do that is find us on social media at facebook.com/enrollnebraska, and our Twitter handle is enrollnebraska. So find us there. I'd love to see a few follows after this webinar. So this group itself is called the EEG, Education and Engagement Group. That's why that link at the end of the webinar says EEG, where our resources are located. And this is our chance to connect with nonprofits, faith groups, schools, government agencies, and other folks who are serving the population that is eligible for Affordable Care Act health insurance. We engage with you folks to do some of the work of reaching out to these low-income folks, because we know there are still tons of people out there who need to find health insurance in our state. We know 80,000 actually from the 2015 community survey that are eligible for Affordable Care Act or Medicaid in Nebraska still. So we do our best to offer concrete resources so that you spend a little bit of time making a high impact sending these resources around the state. So we hope you can appreciate some of that and send that around. a lot of the folks we draw on this call are the idealistic types who can partner with us to help folks find health insurance and really improve lives in a pretty tangible way. So that is Enroll Nebraska and some of the basics about what we do. So we're going to keep this interactive. We have a chance to do a quick poll or two, and the first one is a multiple choice question that I'm going to make the results of public at the end of this poll. So I'm going to start the poll right now. I'd encourage folks to answer the question, what is Heritage Health, on your screens right now, and we'll just get a baseline about who is in the room. This is a pretty basic one. If you have registered for this webinar, I'm pretty sure you're going to know the answer to it. What is Heritage Health? Nebraska's new hospital for elderly pets. Nebraska's new geriatric health insurance. Or Nebraska's new Medicaid managed care program. Okay, we're going to do 5, 4, 3, 2, 1 on answering that. We have a small split, but we will set you straight if you didn't get the right answer. The correct answer, which we're going to learn a lot more about during this webinar, is Nebraska's new Medicaid managed care program. It's like we had 98% select that correct answer, and that's good. Folks who need to learn a little bit more, Heritage Health is the new Medicaid managed care program for Nebraska. Information is going to start flowing to Medicaid recipients September 1st of this year. That is less than 15 days away. The health plans themselves start January 1st of 2017. This is a new program in that it encapsulates 3 different things that were all under different umbrellas before: behavioral, physical, and pharmacy, under a single plan for our Medicaid recipients. Just as a baseline too, in Nebraska, there are 230,810 people in 2015 on Medicaid. It's about 12% of the Nebraska population. And for the new Heritage Health Medicaid Managed Care Program, there are 3 Nebraska providers listed below there. Okay, we're going to jump in with one more quick poll question for the audience, and it's related to our speaker, who is the Heritage Health enrollment broker in Nebraska. And let's figure out how to reset this. Okay, this is your question. What is the Heritage Health enrollment broker's role? I have started the poll, and I believe it is a role that is going to be playing a pretty major role. That's a very poorly constructed sentence. But once again, what is the role of the Heritage Health enrollment broker in Nebraska? Number 1, negotiates with state of Nebraska on plan specifics. Number 2, provides outreach, enrollment, and education to Medicaid recipients. And number 3, sells managed care plans directly to Medicaid consumers. Okay, we're getting a lot of good participation, and looks like we have a clear winner, or at least a majority, with provides outreach, enrollment, and education to Medicaid recipients. And that is, in fact, the correct answer. So everybody should be able to see that poll. We had a little split, but let me explain a little bit about the Heritage Health enrollment broker's role. They are, in fact, the link between Heritage Health, once again, the Medicaid managed care system that is going into effect January 1st in Nebraska, and the Medicaid consumers, all 250,000 or so of them. I believe that's what I said, 250? 230,000 of them in Nebraska. They are contracted with the state of Nebraska to provide outreach, enrollment, and education services from a single unbiased source, helping direct people to the plan that makes the most sense for them in Nebraska. And that is, in fact, where our speaker comes from today. Automated Health Systems is that enrollment broker that has been contracted to do that. And I will let her explain a little bit more about what her role is in Nebraska. But I'm going to introduce her real quickly. This is the Outreach Director for Automated Health Systems. And we'll be presenting for 10 to 20 minutes about her role and what Automated Health System is going to be doing in the managed care process. And so, Linda, I'm going to hand it over to you. Take it away.
Okay, I believe I muted my microphone, so you all should be able to hear me.
I think you're good.
Okay. First of all, let me introduce you to Automated Health Systems. Automated Health Systems is a health service management company with 37 years of experience administrating programs for low-income families. 20 of those years have been in the enrollment broker experience in multiple states, including states like Florida. Florida has 3 million Medicaid recipients, so that's probably our biggest state right now. I have been with Automated Health Systems since May. I am from Nebraska. I've worked in Lincoln for about 35 years in the healthcare industry. But I joined Automated Health Systems because I wanted someone familiar with Nebraska on this project. Next slide, please. What we're going to talk about today is who's going to participate in Heritage Health. I'm going to talk to you a little bit about choice counseling, the enrollment process, and partnership development, which is part of what this webinar is. Next slide, please. Who's going to participate in Heritage Health? The goal is to have all of the Medicaid recipients in Nebraska participate in Heritage Health. There are a couple of populations that are not included in Heritage Health, and those are members that are enrolled in the PACE program. If a member has Medicare as their primary and Medicaid is just their secondary insurance, they do not participate in Heritage Health. Aliens eligible for emergency conditions only are not going to be participating in Heritage Health. And the members who they're not continuously eligible due to the share cost obligation, they will not be covered in Heritage Health also, but everybody else is. Our goal is to get members as much information as we possibly can for them to have a say in who their health plan is going to be. We believe that the more they are knowledgeable and they have and they participate in the process, the better outcomes it's going to be. We do know that not all of the members are going to be able to be contacted. We don't want anybody that's eligible for Medicaid to go without coverage. So there is a point in time where members will be auto-enrolled in one of the 3 plans if they have not chosen a plan. But again, we're going to try to reach out to all the members so they can make a choice. Next slide. What are the benefits, the advantages of the health plan? The freedom of choice. Members having a say in the plan that they select. empowerment by taking an active role in their health care and choosing a health plan. Access to health care. All three plans have value-added services, which are extra benefits. They're a little bit different for each of the three plans, but they do all have value-added benefits. Those are things that the members do not get covered under Medicaid, but under the new managed care plans, they will pay for them. Choice counselors, those are the individuals who are going to be reaching out and helping members make a decision on what the best plan is for them. They are going to be unbiased. They are going to provide all of the education that the members want or need in order to make a good choice for themselves. The choice counselors are in a call center. The call center is going to be is in Pittsburgh. All of the choice counselors have been hired for the Nebraska program. They've been given education on Nebraska, even how to pronounce some of the towns in Nebraska, a little bit about the culture of Nebraska, and they are exclusively with the Nebraska project. It would be way too difficult to have choice counselors covering several different programs because they're all different. So the choice counselors in the call center will be strictly for the Nebraska project. There will be an online website that will go live September 1 that will have all of the information, and it'll be available to members or to the public with all of the information that the members will be getting. Next slide. Choice counseling is a free service. It's made available through automated health systems. There's never any cost to that. The goal, again, is to help everyone make an informed decision and select the health plan that meets their needs and will lead to better health outcomes. The choice counselors will provide information on Heritage Health, the health plan choices, the value-added services, the enrollment timelines, and the website tools. Next slide. Choice counseling provides outreach and education with the outbound and inbound calls. The choice counselors will be available from 7 a.m. to 7 p.m. Central Time, Monday through Friday. They will be, there's currently 24 that are available to all of the members. There's also group presentations such as this one to develop partnerships. I've been working since the middle of July trying to get information out to the folks that members are going to turn to if they've got questions. We know that the Medicaid population have trusted partners, and that's who they're going to turn to, and that's why we want to get everybody informed on the process. And if a member comes to one of your organizations and says, I got this packet of information from Pittsburgh, what is this? I want you to be able to help them to understand what's going on and what the process is to enroll. Okay, next slide. The enrollment process, again, the choice counselors are going to provide information and can actually help get people enrolled. Members can enroll either by mail. There will be an enrollment form and a self-addressed stamped envelope to send back to Pittsburgh, so they can enroll by mail. They can enroll by phone by calling the choice counselors, or they can enroll right on the website. There's a website, there's also a patient portal. Everybody can access the website, only members, Medicaid members can access the portal, and they can do the enrollment online. There is a chat function with the patient portal. The same folks that answer the phones for the choice counseling will be available to chat online to help people go through the process of enrolling. The eligibility stays the same. The eligibility for Medicaid is still through DHHS. The enrollment into one of the plans, that is the enrollment broker's job. Next slide, please. Medicaid members, like I said, can take advantage of the choice counseling, and we hope that they do. And also, if you all have questions, you can access the website. You can also call the call center and to ask questions, so you can help the members that you come in contact with. We will start mailing out on September 5th. The first mailing will go out. Over the next 7 weeks, we will be sending information to members in the form of a member guide. It will come from Pittsburgh. And in that member guide, there's going to be information about Heritage Health, about the health plans. There is a side-by-side comparison document that will be sent to the members that tells the differences between the coverage of the health plans, has information about how to choose the plan, about the value-added services. It has a frequently asked questions, and as much information as we possibly can get to the members. In order to enroll either by phone or online, all the person needs to have is name, address, and date of birth, and either the Medicaid number, Social Security number, or the PIN number, which is on the welcome letter in the member guidebook. And again, the individuals can enroll online beginning September 1 when the website goes live. Next slide. Here's the phone number, and I don't know if anybody recognizes this phone number, but it's the same phone number that's currently used as the enrollment broker phone number through Lancaster County Medical Society. On September 1st, that will go over to us. And then online, www.anyheritagehealth.com. That will be live, as well as the member portal. Now, as I mentioned, we start mailings out to members on September 5th, and a batch will be mailed out every week for the next 7 weeks. So if you've got one person that has gotten their packet but somebody else hasn't, that very well could be. But they will, within the next couple of weeks, they will probably get theirs. One of the things that we are doing is the vulnerable populations, the populations with developmental disabilities or behavioral health issues. They may need a little bit longer time to enroll. They may need some more assistance. So those populations, their mailings will go out first. So that over the first 3 weeks, those mailings will go out. Okay, next slide. Partnership development, that's what I'm doing today. We want to partner with stakeholders, with community-based organizations who actually help the members enroll. It's really important that you understand the process. And I will encourage you on September 1st or thereabouts, go check out the website. All of the documents that are being mailed to the members will be available on the website, including the side-by-side comparison. I really encourage you to download those and just check out the website for the information. Next slide. Again, partnership development. We're trying to reach out to as many people as we can to help the members in Nebraska through this process. Next slide. And how can you help? I'd be happy to come and talk to folks around the state. I am the only one in Nebraska, so the outreach, the in-person outreach is up to me, but we can do webinars, we can do phone conferences. If you have questions, you can certainly get a hold of me. Refer folks to the website, to the choice counselors. If they come to you, let them know how to get help and who to call. And just let us know if there's any health fairs or any other way that we can help get the word out. Next slide. Again, our goals as the enrollment broker: give focused and unbiased information to members, reach, understand, and accommodate individuals with special needs, enhance the choice counseling component and availability. Now, I did mention that there is a point in time where if the person hasn't enrolled, that they will be auto-enrolled. That date is December 8th. Anyone who has not been in contact with us to help make that choice will be auto-enrolled in a plan. There's an algorithm to determine what plan. It's not just willy-nilly, but there's an algorithm. For instance, if they've had any contact with any of the plans, or if a family member is involved in one of the plans, they're more likely to be selected for that plan. So there's an algorithm. But the one nice thing is once the plan becomes effective, the person has 90 days from that date to change if they so choose. So if they space off and they don't get in contact with us, and on December 8th they're auto-enrolled, they get information that they were auto-enrolled into Plan B, and they don't want to be, they can call the choice counselors or go online and they can make a change up to 90 days after the effective date. The effective date isn't until January 1st, so it's 90 days after January 1st. After January 8th, after this initial enrollment period, as soon as someone new becomes available or eligible for Medicaid, they will be auto-enrolled at that time. The reason for that is that because pharmacy benefits are included, physical health, behavioral health, all of those are included, we don't want there to be a gap in coverage. So as soon as they're eligible, they will be auto-enrolled, but again, they have 90 days to change. If they don't like the plan, or they want to try something different, or maybe their PCP, they have an idea who they want for their primary care physician. If that physician does not participate with the plan that they're auto-enrolled in, then they can change. No problem, 90 days, okay? Next slide. This is my contact information. I have an office in the US Bank building downtown. Don't spend a lot of time in the office, but you can certainly email me or give me a call if you've got questions. Please don't hesitate to contact either me or the choice counselors after September 1st. Next slide. Wanted to tell you that there are a couple of forms that are available now. One of them is this educational flyer, and it gives the important information, the telephone number and the website address and the mailing address. And then the next one is the side-by-side comparison tool. And it, like I said, it's a two-sided document, and it has not only what benefits all three plans have, but also those special benefits, those extra benefits that each of the plans have. These are available. They will be available on the website. There's also on the website, there will be a search function. So if somebody has a primary care physician that they want to stay with, they can go on and search and see which plans that particular physician is participating in. So that will help with the choice as well. The choice counselors can also do that search, but it is available to anybody that wants to search the directory. So looks like we've got some questions. Eric, do you want me to send it back to you, or?
Yeah, why don't I moderate this? So folks, yeah, thank you so much, first of all, Linda, for presenting to us and this large group. We have over 100 people registered and about 85 on the line. So we have quite a few to go through, and I'm going to moderate them if you don't mind. And Linda is going to be on the line until we get all our questions answered. And like you see on the screen, there are ways to contact her or myself following this presentation. So let's go back to the beginning of questions. And the first one I'm going to pose to you, Linda, is, will choice counseling be available in other languages?
Yes, it will be. In fact, all of the printed material and the website will be in both English and Spanish. There's also a translation line that the choice counselors can utilize, and there's any language that is needed, we will get someone to assist with translation.
Great. Next question, and folks, continue putting questions in the box. We'll do our best to get to all of them. Let's see, the next one is, how will the choice counselors assist with choosing a plan that covers medications that a child is taking?
They will have access to the formulary that is for each of the plans. One of the things that the state is working with the plans is to try to get a standardized formulary. So they're all covering the same medications, but the choice counselors will have that information.
Sounds great. The next question relates to that. Yeah, I think you've answered that. The formulary will assist with specific medications. Okay, from Margie, are all Medicare/Medicaid beneficiaries excluded from managed care?
The individuals that I spoke about, the ones in the PACE program, the ones that have Medicare as their primary, the ones that have the share of cost obligation, they're excluded. Everybody else, the DHHS really wants to get enrolled in one of the three plans. Also, one thing that I will tell you is that on that side-by-side comparison, there are contact information for all three plans. So if you or a member has specific questions that's not something that the choice counselors can answer, or not in the degree of specificity that the person wants, they can certainly contact the plans. They're more than happy to help talk about their particular coverage.
Great. Will asks, will we have access to the guidebook? I think you mentioned the guidebook.
Yep, that's one of the things that will be on the website that can be viewed and printed off. Everything that goes out to the members will be on the website, and anybody can go on the website and get that information. I believe that the guidebook just got, well, the content got approved. Everything is under the direction of DHHS, so it all has to, the content, the layout, everything has to be approved. I believe they're waiting for the layout to be approved. And as soon as that happens, then it will go to translation to be translated into Spanish, and so it's ready for the website. As things get approved, I've been sending those to the individuals that I've been working with to get the information out, and I will continue to do that until the 1st of September when it'll all be available.
That sounds good. Terry has a question and a comment. If papers come from out of state, which the application mailings that start September 1st and go through October 10th or so, if papers come out from out of state, my clients will not open them. How will this affect them if they do not open them?
Well, the return address will be Pittsburgh. Heritage Health logo will be on the outside. Everything will be tagged Heritage Health. And if they will get the original mailing, and then they'll get a follow-up mailing. Again, everything will have Heritage Health. And I guess the best thing to do is to copy off those flyers and have those flyers available, and just let folks know if you get something from Heritage Health, please open it. But again, if they don't respond, they will be auto-enrolled, and then they will have 90 days to change if they so choose.
All right, Sarah says, if one of the plans deny coverage, will the appeals process be the same as in the past?
Yes.
Okay. Good answer. I'm going to filter Rachel's. We have the side-by-side plan comparison tool that you can download at enrollnebraska.org/EEG, or within the chat box, I've put the download direct links as well. A good question for you, Linda, is if it's all Medicaid, why isn't there a standard plan of coverage among the three? Why are there, I'm looking at to elaborate on the question a little bit, specifically there's a $30 every 3-month copay, it looks like, for one plan and none for another.
And one of the things in the process of setting up Heritage Health, the state, certain individuals with DHHS have been working with the enrollment broker. Another group of individuals have been working with the plans. I know that DHHS had very specific criteria for the enrollment broker and very specific criteria for the health plans. I don't know what the criteria was for the health plans, but I do know that they did have criteria. Not one health plan is going to fit everybody. And I think that that's the whole point of giving people choices, means that there's going to be a little bit of difference. But that's about as much as I know about it. That might be a good question for DHHS. Why did you set it up that way?
All right, thanks, Linda, for that one. Will there be counselors trained for local areas if someone wants to talk to people face-to-face?
No. The choice counselors are all in one spot. They're, like I said, I'm the only AHS person in the state, but I feel like by phone or by website with the chat availability, I think that people can probably get their questions answered. We can certainly if there's a member that is really hesitant to call on the phone, there's no reason why somebody that they trust, if the person is there, if the member's there and can give their permission for the choice counselors to talk to somebody else, they can certainly talk to somebody else and help. They can help explain to the member.
Okay. Okay, we got quite a few still to go. So PCPs are a problem as they reside in multiple locations and may have doctors in different towns depending on who has custody on the date of service. Well,
I'll tell you, I will let you know that selecting the primary care physician goes through the managed care organization, not through the enrollment broker. So I know that the plans are trying to get a full complement of providers to sign on. But if you've got questions about the availability of PCPs, I know that has been a concern and they're trying to work on that, but that would be a question for the managed care organizations.
All right, and we're making a list of some of these that we have to get back to folks on, and we'll try to send that out by email with questions and answers, hopefully. Next question, after auto-enrollment, if an individual does not like a plan, do they have 90 days to change? That is correct. After January 1st, the plans are activated, and folks have 90 days to make a different selection if they don't like theirs.
Correct. It's from the 90 days from the effective date. So January 1st is the effective date of coverage, so they've got 90 days from that date.
Okay. Nina says there are more than one PACE entities. Which one are you talking about?
Well, I was told by DHHS that there was only one PACE. Anybody enrolled in a PACE organization or a PACE program, they are not going to be included in Heritage Health at this time.
Got it. Okay, so that should be a blanket kind of exclusion. Okay, another one. Will Magellan still have managed care for behavioral health patients?
No.
Right, so the three choices now are Nebraska Total Care, United Health, and Well Care. So those are the new contracts. All past contracts are going to be ending December 31st, I'd say.
Correct.
All right, let's keep on trucking. We're doing well. What happens if a client is auto-enrolled with a plan that the client's primary care physician doesn't participate with, and that client sees that out-of-network primary care physician? They want to support the medical home concept.
What I would suggest is if they're auto-enrolled in a plan that their PCP doesn't participate in, to change the plan to one of the others that the physician does participate with.
Sounds good. Will the managed care system affect or no longer pay for individuals who have Medicaid to pay their Medicaid Part B premiums?
That one I I do not know where that issue falls. I'll have to check on that.
All right. Will all information regarding the plan that they chose or auto-enrolled be coming from Pittsburgh?
Part of the information will come from Pittsburgh. Part of the information will come from the health plans. And I believe the health plans have mailing addresses in Nebraska.
Okay. Sounds good. Amelia asks, do any of the managed care programs offer transportation as a valued benefit? I'll make sure folks are downloading the plan comparison tool.
Yeah.
Affect some of this, but is that listed, or do you know about that, Linda?
I can't tell you without looking at it. I don't have it memorized. I would suggest that they download the tool and look and see what the benefits are for each of the plans.
It does look like WellCare, I'm looking at it right now, has supplemental transportation, and the quote I can give you off of the sheet is covers the cost for family or friends to take you to your appointments. I'm not exactly seeing it in other plans, so that hopefully answers the question.
Well, one of the things also, I know that DHHS has a lot of information about Heritage Health on their website, and one of those things is frequently asked questions by members. And there was a question about what doesn't change with Heritage Health, and there's a couple of things that are listed that they are not changing with Heritage Health. One of them is dental, school-based services, non-emergency transportation, and long-term supports and services will continue as they are today.
So another piece of information to share with folks is some of this transportation is covered under standard benefits. What is this word? So
That's what she just said.
exactly. So just like Linda said, some of it's listed as value added, but throughout there are some, the plans, well, looking closer is important. I'll say that. Okay, is there next question I'm going to jump to from Nina. Is there a TTY number? And I'm not getting the acronym myself, but Linda, do you have that? Oh, is that hearing impaired? Yes. So Linda, can you hear me? Thanks, Nina. Confirming it's the hearing impaired number. Linda, I have you muted somehow. Are you?
Oh, can you hear me now?
There you are. Okay.
Oh, okay. Yeah, the number is 711. It's on the educational flyer listed underneath the telephone number.
Got it. So it's listed on all materials as 711 for TTY.
Correct.
Great. All right. Let's keep on going. Thanks for everybody's participation and paying attention. Ashley says, if someone decides to change their plan during the 90 days, is there a time period similar to the marketplace where they need to enroll before the 15th of the month to get a very next month start date?
No.
Okay, so to clarify, Linda, so if they decide they need to switch plans, they call the help center, they can do that day of and be on the next plan that day, or is there a time limit?
They will be on that plan the first of the month, the following month, yes.
Okay, so they will continue on the current plan for 1 month or through to the end of the month, and then the first day of the next month, they will be on the new plan.
Correct.
Got it. All right. Next question. Margie says, according to Heritage Health website, dual eligible beneficiaries are included in Medicare managed care, Medicaid managed care. I'm getting mixed information on this topic, and where can I get a definitive answer on this?
On the DHHS Heritage Health website, under the frequently asked questions for members, that's where I got the information that if the patient has Medicare, or if the member has Medicare, and they have Medicaid as their secondary coverage for copays and that sort of thing, that they're not part of Heritage Health. Where on the Heritage Health website did you see that they are included? I can certainly clarify that, because there may have been a change since the frequently asked questions were on the website. I can certainly check on that and get back to you guys.
Yeah, that'd be great. Margie, if you have a chance, send us the location of the information you're getting, and I'll make sure to connect you, and I'll report back to the rest of the group. All right, so Amelia.
Eric, I will tell you that eligibility, to really answer Margie's question, eligibility is still under the guidance of DHHS. The enrollment broker does not determine eligibility for Medicaid. So that would be a question for DHHS, but I will certainly do some investigating on it.
Sounds good. All right, and Amelia asks if it'd be okay for us to reach out to the managed care programs to speak about their plans. And Linda, maybe you can help facilitate some of those connections, and I can send them on. Amelia is one of the enrollment assister managers in Omaha, so I think that might be a good next step for that.
To get folks to get a contact person for the managed care plans, is that what you're looking for?
I believe so, yeah. If you have those, or if you could help facilitate some more training on each plan, that might be nice.
Okay, that's a whole different group of individuals, but I can absolutely get names and email addresses of folks that can help set that up.
That sounds great. All right, so we have time for one or two more questions if you have them. I think this group has questioned out almost, which is a good thing. I really want to thank everybody for joining today. I'm going to go through a couple more things. There's still time to ask questions, but there are a couple slides left to go. One particularly talking about our next one of these kind of webinars. And it's going to go back to basics for a lot of you, but can be useful for organizations who want to learn more and help get folks enrolled November 1st through January 31st in ACA coverage. It's going to be September 21st at 12. Register on the website. You downloaded the information you learned today. I think folks know, but we are recording this as we speak, and it will be available, sent to you all in an email in a couple hours or an hour or so, and also available at enrollnebraska.org/EEG. So, once again, follow us on social media if you want to stay up to date on all of this stuff. And you hopefully will not mind me adding you to webinar outreach emails for this group specifically. Okay, let's see. One more question, and we have some specifics to follow up on for the question Margie brings up. So any other questions before we head off? please send. I'm going to go back to the slide and we'll end on the contact information. Send this to us and we'll try to follow up with you about the questions asked and not answered directly on this webinar. Once again, thanks to Linda from Automated Health Systems, and be on the lookout. Thank you for being connectors in this system, everybody on the call. You will be there to help make this a successful rollout of Medicaid managed care. So we appreciate your work there. And I will provide a list of Q&A that took place here on this webinar and leave it on the Enroll Nebraska website as well. All right, everybody, thanks for your participation. Have a great day.
Thank you, Eric. Thank you.
Thanks, Linda.